Life by Dr. Pat. Leading innovation in fertility excellence.
Deep dive into reproduction with Life by Dr. Pat.
If your uterus is really normal, why you're still childless.
Dysmorphic T-shaped uterus.
Welcome in, everybody. Ready for another deep dive? Today, we're going deep into the world of the dysmorphic uterus. Now, this is a condition that can really impact fertility, and it's something we may not hear about every day.
Yeah.
So we're using a couple of sources to guide us, some medical websites, and I've also got some excerpts here from a really interesting piece called Dysmorphic Uterus 101. It's
interesting.
It's by reproductive medicine specialist in Thailand, Dr. Patsma Vijin Saswijit. And one of the things that jumped out at me right away was that a T-shaped uterus, which is a particular type of dysmorphic uterus,
Right.
it's actually way more common than we might think, especially for folks dealing with infertility.
It is. It is. It often doesn't get the attention it deserves.
So to kick things off, can you break it down for us? What exactly are we talking about when we say dysmorphic uteruses? And how does that T-shape even happen?
Sure. So think of the uterus as a muscular chamber, right? The myometrium, it's where a baby grows. Now, with a dysmorphic uterus, that muscle layer, it gets too thick, especially at the top. So, picture this.
Yeah.
Instead of that typical triangular shape we think of, it gets constricted at the top, forming a T-shape. And because of this thickening, the uterine cavity ends up smaller.
Okay, so we've got this smaller space now. Why is the size of that cavity such a big deal when it comes to fertility?
Well, because that restricted space, it messes with the blood flow to the endometrium. That's the lining of the uterus, and that lining, that's where the embryo needs to implant, right?
So if an embryo can't get comfy there, pregnancy becomes a lot tougher.
Exactly. And it's not just about getting pregnant either. That limited space can affect how the fetus grows later on, leading to more complications.
So for anyone listening who's had trouble conceiving or maybe experienced recurrent miscarriages, could this be something worth looking into?
Absolutely. It could definitely be a factor.
Now, besides the obvious difficulty getting pregnant, are there any other signs, any symptoms that might point to a dysmorphic uterus? What should people be watching out for?
Dr. Patanza, he lists some really subtle but important indicators, like consistently light periods. We're talking using less than 3 pads a day.
See, that's not something I would have immediately thought of as a uterine issue. How's that connected?
It seems a little counterintuitive, but it all boils down to the size of that uterine cavity. Smaller cavity means less surface area of that lining, the endometrium, hence the lighter bleeding.
Interesting.
And another thing, might surprise you, is a high hematocrit level.
Now, hematocrit, that's the measure of red blood cells in the blood, right? What's the link there?
It is. And basically, a higher hematocrit can sometimes mean less blood loss during menstruation, again pointing to a smaller uterine cavity.
So even these seemingly random symptoms can help put the pieces together. So how do doctors actually figure this out? How do they diagnose a dysmorphic uterus? What tools do they use?
Well, the most common way is a 2D ultrasound, but it's got limitations, you know? It gives you kind of a flat picture of something that's pretty complex.
So potentially missing some key details.
Exactly. So that's why more and more we're seeing 3D ultrasounds being used. They give you much clearer, more detailed images so you can really assess the shape of the uterus.
Like the difference between a regular X-ray and a high-resolution CT scan.
Good analogy. Then there's hysteroscopy. This one lets you actually see inside the uterine cavity directly using a thin, lighted scope.
Sounds a little more intense than an ultrasound.
Yeah, a bit, but it also gives you the most accurate diagnosis. You can see the shape, any abnormalities, even do some procedures right there.
Speaking of procedures, I saw that Dr. Patsama's website mentioned something called hysteroscopic metroplasty. What's that all about?
Now that's where things get interesting. It's a minimally invasive surgery that can actually correct the shape of the uterus.
Wow, so they can actually reshape it. Sounds kind of sci-fi. Walk me through how that works.
So they use that same hysteroscope we talked about, but with surgical tools. Basically, they cut and reshape that muscle wall to make the uterine cavity bigger.
So how safe is this procedure? And the big question, I guess, is it effective?
Generally, yeah, it's considered both safe and effective. And the recovery time's pretty minimal. Dr. Patsama's site says they've seen a 72.5% success rate for pregnancy within a year of the surgery.
That's pretty amazing, but I'm guessing there are still other things to keep in mind.
Oh, for sure. Even after a successful surgery, some folks might still need additional help, like IVF.
So it's not a guaranteed fix for everyone.
Right, that's important to remember. This deep dive, it's all about giving you the info, not about stressing you out or making promises.
Good point. Understanding the possibilities, not necessarily guarantees. So, based on what you've seen in Dr. Patsama's research, what are the chances someone could conceive naturally after this procedure?
Well, his research shows about 2/3 of patients were able to conceive naturally after the surgery, while the other third did end up needing assisted reproductive technologies.
So there's definitely hope for those considering hysteroscopic metroplasty.
Yeah.
I know every case is different, outcomes can vary, but this is really helpful information for anyone going through this.
For sure. But it's crucial to remember every fertility journey is unique. That's why talking openly with your doctor is so important, figuring out the best path for each individual situation.
Couldn't agree more. We've covered a lot of ground already. What would you say is the biggest takeaway for our listeners so far?
I think the most fascinating thing is that even a small difference, like the shape of the uterus, can have a huge impact on fertility.
Right.
It really shows you how intricate the reproductive system is and why it's so important to investigate thoroughly when someone's having trouble conceiving.
I'm with you there. It reminds us that even when other common fertility issues are ruled out, a uterus that looks normal on a standard ultrasound might still need a closer look.
Exactly. And that brings us to a really interesting question that Dr. Patsama raises.
Ooh, now you've got me hooked. But I think we'll save that for part 2 of our deep dive into the dysmorphic uterus.
Sounds good. Looking forward to diving in deeper.
Me too. All right, welcome back, everybody. Glad you're here for part 2 of our deep dive into the dysmorphic uterus. You know, we left off with a bit of a cliffhanger last time. You were about to tell us about this intriguing question from Dr. Patsama.
Oh, right. He suggests that even when other common fertility issues are ruled out, a uterus that seems totally normal, it might still need a closer look.
Now, I'm even more curious. Why would a seemingly normal uterus raise any eyebrows?
Well, a regular 2D ultrasound, it might show a uterus that looks structurally fine. But remember, those 2D images, they don't always pick up those subtle differences in shape, especially when it comes to the muscle layer.
So like a dysmorphic uterus hiding in plain sight.
Exactly. That's why Dr. Patsama is a big advocate for 3D ultrasounds and hysteroscopy. They give you that much more complete picture, a more accurate assessment of the shape, and any potential problems.
So what you're saying is even if that initial ultrasound doesn't raise any red flags, if someone's still struggling to conceive, further investigation could be worthwhile.
For sure. Being proactive and really advocating for your own reproductive health is so important. You know, if you've been trying for a while, haven't had any luck, other causes have been ruled out, don't hesitate to talk to your doctor about those more advanced diagnostic options.
That's great advice for our listeners, really empowering.
Wow.
Knowledge is power, right? Now, I want to shift gears a bit. Dr. Patsama's clinic is described as a digital hysteroscopic clinic. What does that even mean?
Yeah. Digital hysteroscopy, it's basically an upgrade from the traditional hysteroscopy. Instead of using a simple lens, it uses a tiny digital camera to capture these high-def images of the uterine cavity.
So like a mini HD cam touring the inside of the uterus.
Pretty much. And the benefits,
Yeah.
big time. Clearer, more detailed images leading to more accurate diagnoses, and if you need surgery, more precise interventions.
And probably a more comfy experience for the patient too, right?
Right, yeah. The digital hysteroscope, it's usually smaller, more flexible than the traditional ones. Less invasive, generally more comfortable.
Sounds like digital hysteroscopy is a win-win for everyone involved.
Yeah, I'd agree. Good example of how tech is constantly changing healthcare, especially in reproductive medicine.
And speaking of reproductive medicine, I know Dr. Patsama specializes in IVF too. Does his expertise with dysmorphic uteruses influence his IVF approach at all?
Absolutely. Understanding the shape and condition of the uterus is crucial for successful IVF, you know? If a patient has a dysmorphic uterus, Dr. Patsama might recommend hysteroscopic metroplasty before even starting IVF, increases those chances of successful implantation.
So correcting the shape of the uterus could actually boost IVF success rates.
Right, like prepping the soil before you plant a seed, creating best environment for that embryo to implant and grow.
Makes sense. Really highlights the importance of a holistic approach to fertility treatment, looking at every possible factor.
Couldn't agree more. But, it's important to acknowledge that as awesome as these advances in tech and surgical techniques are, we're still learning a lot about dysmorphic uteruses and their impact on fertility.
So more research to be done.
Oh, tons. Reproductive medicine, it's constantly changing. Ongoing research is key to really understanding and improving treatment for conditions like this.
So we're just scratching the surface of this condition, it sounds like. Any other big takeaways you'd emphasize for our listeners before we wrap up this part?
I think the big one is that being diagnosed with a dysmorphic uterus, yeah, it can be tough, but it's not a dead end. With the right diagnosis, the right treatment and support, people with this condition can still become parents.
That's really reassuring. Something that stood out to me is that Dr. Patsama's clinic seems to offer such a well-rounded approach to fertility care.
Yeah, it's true. They've got it all: consultations, diagnostic testing, the advanced stuff like metroplasty and IVF. They even have a mobile app to help patients manage their journey.
Wow. Sounds like they're dedicated to providing really personalized, compassionate care.
Yeah, it seems like it.
Well, on that note, I think we'll wrap up part 2 of our dysmorphic uterus deep dive. We'll be back soon to continue this fascinating exploration.
Looking forward to it. Until then, everyone, keep learning, keep asking questions. Knowledge is your best friend on this journey.
And we're back, everyone, for the final part of our deep dive into the dysmorphic uterus. It's been quite a journey, hasn't it?
It really has. We've come a long way. From the basics of what a dysmorphic uterus even is to the cutting-edge tools and treatments available.
We've got to peek inside Dr. Patsama's clinic in Thailand and his approach to fertility care.
Yeah, and his clinic's focus on patient-centered care really impressed me. They go above and beyond to make sure their patients feel informed and supported every step of the way.
Absolutely. That holistic approach stood out to me, too, offering a wide range of services beyond just IVF and surgery.
It's true. They cover everything from preconception counseling to menopause management. They even offer genetic testing and non-invasive prenatal testing.
Wow, they've really thought of everything when it comes to reproductive health. Before we wrap things up, I want to circle back to something we touched on earlier, the importance of early diagnosis.
Yeah, definitely key. The sooner a dysmorphic uterus is identified, the sooner treatment can begin. And that can really improve the chances of a successful pregnancy.
So how would someone know if they should be screened for a dysmorphic uterus?
Well, if you've been trying to conceive for a while with no luck, or if you've had multiple miscarriages, it's definitely worth talking to your doctor about it.
And what if someone isn't experiencing those specific issues, but has some of the other symptoms we discussed, like consistently light periods or a high hematocrit level?
Right, those could be subtle hints that something's off. Even if a basic ultrasound looks normal, it's still worth considering those more advanced imaging options, like a 3D ultrasound or a hysteroscopy, just to get a really thorough evaluation.
Makes sense. Better safe than sorry, especially when it comes to reproductive health. We talked about Dr. Patsama's success rate with hysteroscopic metroplasty, and it was impressive. But realistically, surgery isn't always the answer, is it?
No, you're right. It's a big decision, and it's not always necessary or the best route. It really should be a case-by-case decision, looking at each person's unique situation, their fertility goals, and their overall health.
So it's crucial to have that open conversation with your doctor, weigh the pros and cons carefully before making a choice.
Exactly. And even if surgery is successful, it's important to understand that some people might still need additional fertility treatments to help them conceive.
So it's not a magic solution, but it can improve the odds for some. I think it's important to acknowledge the emotional side of all of this, too. Dealing with infertility can be incredibly tough, both physically and emotionally.
You're absolutely right. It can feel like a roller coaster with all the ups and downs, the hope, the disappointment, the frustration, sometimes even grief. Having a strong support system is so important, whether it's your partner, family, friends, or even a therapist.
And there's no shame in reaching out to support groups or online communities where you can connect with others going through similar experiences.
Absolutely. Sharing your story and hearing from others can be so validating and empowering. It helps you realize you're not alone.
Right, and it's okay to ask for help. You don't have to go through this alone.
I can't stress that enough. There are resources available, and there are people who care and want to support you.
We've covered so much ground in this deep dive. As we wrap up, what's the one thing you hope our listeners take away from our conversation?
For me, the biggest takeaway is that knowledge is power. The more you understand about your body and what can affect your fertility, the better prepared you'll be to make informed decisions about your reproductive health.
So true.
Keep asking questions, keep learning, and keep advocating for yourself. And never forget, you're stronger than you think, and you are not alone on this journey.
Well said. And remember, there's always hope. Reproductive medicine is always advancing, offering new possibilities and reasons to be optimistic.
What a perfect way to end our discussion. Thanks for joining us on this deep dive into the dysmorphic uterus. We'll be back soon with another fascinating topic to explore. Until then, take care, everyone.
Leading. Innovation. Fertility. Excellence. Life by Dr. Pat. Leading innovation in fertility excellence.